I always tell doctors about camera settings, not as detailed as you, Dennis. I'm not a professional as you. I can take some okay photos. But when I teach doctors about settings on cameras who absolutely have no idea and just bought the camera, I just send them a photo here you can see on the screen right now, and I tell them use these settings and you will take a good photo just by changing, for example, the shutter speed. And we're going to talk about all of this. The aperture, everybody knows f-stop.
Correct.
So we're going to talk about what is f-stop. Many people heard it, but nobody knows what it is. Or not many people. We're going to talk about ISO,
right.
ISO,
correct.
And what does it mean. And a really important point is also the white balance.
Right.
The white balance. And then sometimes I get photos from doctors with a low quality photo because they want to send it by email. But this is a big mistake, right? To send low quality photos. So you should set your camera on a large JPEG file or even in RAW. LCD photos you need to take in RAW
That's
format.
true.
And RAW is not compressed. But that is the most photographed slide I have here in my
this
lectures.
One, right.
This one, many people take notes of this one, many people take photos of this slide because it's an easy start.
It's
right?
an,
It's an easy start. You go from here and you can take wonderful photos. So I always set it on manual.
On manual.
I know you said it differently. You go to AV, which is Aperture Priority.
Right.
But especially if you take ACD photos, you want to have all the photos at the same quality, at the same level.
Right. Yeah. So
want to comment on that?
Yeah. So it's a very, very good point. It depends on what your goals are, and what Carson was saying very simply is. It's called the mode dial on the camera. He puts it on manual, which basically means you're in total control of the aperture and the speed, and so and the distance at which you're going to take your picture. So if you're doing a series, every single time you take a particular picture, it's the same distance all the time. But that might not be the best setting for many of you viewers that just want basic all-around photo documentation. For example, Karsten, you may have a setting for just say 6 front teeth, and you have everything set perfectly for that. Well, what happens is when you get back further, let's just say for a natural smile, so the distance may be a little bit farther apart, then it may be too dark or too light. So manual's fine if you're doing something like what Karsten does, or for those advanced users, but many of you that just want basic photo documentation, aperture priority, or some call it AV, or aperture value, is a better setting. Now in that setting, you determine what the depth of field is and the importance of being able to take pictures where everything is in focus. And we use a higher number, like f32, f29, or somewhere in that range. But the user is in charge of what that number is. Let the camera decide the camera speed, because cameras are pretty smart. So it's just ease of use for you viewers.
Okay. When we go to the focus mode on the macro lens, many people, they said, okay, I see AF and I see MF. What does that stand for?
Okay. So AF would be automatic focus. So the lens itself, or the camera, then will focus. It doesn't matter what the distance is. But that creates a problem. Again, if you're doing a regular series and you want the same picture all the time, the length and width or the aspect ratio, then you put it on MF, or manual focus. And basically what you would do is you go farther or closer, and you set it accordingly to the type of picture that you want, okay? But that way you'll get the same picture every time as far as what's in the picture. So that manual focus, and don't be confused, because the manual focus on your lens is not the same as M on your mode dial on your camera. They're totally different things, even though they both are M.